Hey CE Impact subscribers, welcome to the Game Changers Clinical Conversations podcast. I'm your host, Josh Kinsey, and as always, I'm excited about our conversation today. Cancer care is no longer just about treating the disease. It's about supporting the whole person. In this episode, we'll discuss the growing field of integrative oncology and how pharmacists can help patients safely navigate complementary therapies alongside conventional treatment. Before I introduce today's guest, I wanted to quickly mention that we're excited to bring you this special crossover episode today in partnership with Encoda's The PQI podcast, hosted by Ginger Blackman. At CE Impact, we're committed to delivering high-quality, accredited education that empowers pharmacy professionals in every practice setting. And this collaboration is a perfect example of that mission in action. Encoda's mission is to empower the medically integrated oncology team to deliver positive, patient-centered outcomes by providing leadership, expertise, quality standards, and best practices. It's a privilege to team up with Ginger and the Encoda team to share meaningful insights that support excellence in oncology care. Again, it's so great to have Ginger Blackman as our guest for this episode, and for many reasons, not just because she's brilliant in this space, but not because she's just dedicated her whole career to cancer care, but because Ginger and I have been friends for 25 years, which that seems like a lot when I say it out loud. But Ginger and I went to pharmacy school together, and we studied abroad in Europe together. We have great stories and memories from that. And oddly enough, now my husband works with her at Encoda. So lots of connections. Ginger and her family are very special people to us. And we have been talking about having a crossover episode for a long time since she hosts Encoda's podcast, and we finally made it happen. So Ginger, welcome. Thank you so much for being here.
Thank you, Josh. I'm so excited to be here. And I was thinking it's 20 years this year.
Yeah, I know. We celebrated our 20th graduation. So we have been
Yes.
pharmacists for 20 years. Yeah, wild.
It's crazy. But I also, like you, I know we're the planner, so I don't know where our 20-year reunion is, but it didn't
Yeah,
happen.
it was on me as president of the class. I was supposed to be planning that 20th year. You know what? We'll just do a 25th. We'll do a
Okay.
silver and just make it really big. So
That
yeah,
sounds great.
that's
That
the
would be
plan.
great.
That's the plan. All right. Well, Ginger, again, thank you so much. As I always like to do before we get started, I want our learners to know a little bit more about you. So if you'll just take a couple minutes to tell us a little bit about your practice site and the company, and I know that you have a reason why you're passionate about this topic. So tell us a little bit about that too.
Yes, certainly. So, as you said, besides getting to travel to Europe and all those good things with you many years ago, I do have a passion and background in oncology. So, soon after we graduated from pharmacy school, like within a week, I was diagnosed with non-Hodgkin's lymphoma. Had it a couple of times, and in that kind of shifted my path to oncology from community pharmacy. So, I ended up several years later in a community oncology practice here. I'm in Jacksonville, Florida. Was pharmacy manager there at a medically integrated pharmacy and an Encoda member at the time for about 8 years. And then I've been on staff with Encoda. I'm the associate director of clinical initiatives. So I've been with Encoda for 5. During the time in the clinic, I did become certified in aromatherapy. I used a lot of integrative medicine during my own treatment and during survivorship, helped heal a lot of things. So really became a believer in absolutely. We have amazing oncology treatments right now. That landscape is changing every day, changes so fast, which is one reason why what we do at Encoda is so fun and unique because we get to be part of that. But also the need to combine that treatment with things that are more integrative and complementary, sometimes a little bit more like Eastern medicine in care.
Yeah, no, that's great. And Ginger mentioned another word, which I'm going to pull out and mention to our audience that I'm hoping to have an episode on this soon. But she mentioned survivorship, and that was a new thing for me to hear about and understand in the space of oncology practice. So hopefully I'll whet your appetite a little bit as a listener, and you'll tune back in when release an episode at some point on survivorship. But yes, thanks again, Ginger. Such a great story. And I mean, your passion is so incredible, and it's because, like you said, you've been through it and you really wanted to help others and to make that change, and it's just so great. So let's talk about what we're here to talk about today. We could reminisce, we could go down the path of reminiscing for a long time.
We can have a 3-hour podcast.
Absolutely. If everyone wants to sit back, we could pull out old pictures. And, we studied abroad before like smartphones were a thing. So when I say we have pictures, like we have actual like printed out pictures. So I was thinking about that the other day. I wanted to grab something and I realized that I would have to take a picture of a picture in order to like post it somewhere. Yeah.
And then I even like did that bad thing and was scrapbooking. So like some of mine, I'm like, oh man, like I cut this like into pieces. Everything is cut up.
Yep.
Because I wanted to make it look so nice. And
so nice. Yeah. It's different times. Yeah. We're definitely getting old. But anyway, what we're here to talk about today is integrative oncology. And what I want you to do first, Ginger, is to really define that for us. Like, what does that mean? What do you mean when you say integrative oncology? You've kind of hinted to it a little bit, like aromatherapy and complementary products and things like that. So if you'll tell us exactly what integrative oncology means so that we're just kind of on that same foundation as we talk through things today.
Absolutely. And I'm going to actually give you, there's a Society for Integrative Oncology. So I will plug them and say, check out their website. They have a lot of the guidelines and different things, which we'll talk about shortly, for integrative care in oncology. But I'm going to give you their actual definition. So they define it as a patient-centered, evidence-informed, which evidence we love, field of cancer care that uses mind and body practices, natural products, and or lifestyle modifications from different traditions alongside conventional cancer treatments. Integrative oncology aims to optimize health, quality of life, and clinical outcomes across the cancer care continuum, and to empower people to prevent cancer and become active participants before, during, and beyond cancer treatment. So I would love to highlight in that, again, like the evidence. While we don't have enough, and we'll talk about that as well, there is a lot of evidence towards the integrative medicine and different kind of components of that. And also patient-centered, because again, we're giving patients a little bit of power back into their hands through this, but also alongside conventional treatment. So we're not asking anyone to forego conventional treatment, to not listen to what their oncologist says. But these are things that can help really improve a patient's quality of life and even some treatment outcomes alongside what their oncologist prescribes for them.
Yeah. And those are the exact things I would have pulled out as well, and I wanted to highlight. So thank you for doing that. But yeah, just to reiterate, that we're not saying like instead of the traditional treatment that would actually potentially cure you or help you through or whatever, we're going to tell you to go take some vitamin C. Like that's not what we're talking about today. We're talking about, again, those complementary things, those things that have shown evidence to help support, as Ginger said, the quality of life of the patient and just to kind of make that process better. So this is not in place of, this is in addition to, and I think that's what's really important to note as well. Okay, so why is this relevant? Like, why is this? I feel like it's something, it's probably not brand new, but I feel like it's gaining traction, I would say, in the last few years. And so, what has kind of built that scope and relevance around integrative oncology?
So I will say, as pharmacists, sometimes we hear it and we're a little bit afraid because it's not our traditional medicine, traditional drugs.
Well, it sounds like, this is like witchcraft, or are they telling me to like go out and scrape the tree bark and all that kind of stuff. Like that's what we think when we hear like non-traditional or complementary. So yeah, I completely agree. There's hesitancy sometimes. Yeah.
I also we don't want to completely, because of that, tell patients like, no, don't do anything. There are already around 50% of cancer patients worldwide that are using integrative medicine or something that we'll talk about here today. So, and that I was surprised even to find out like low, middle income and developing countries are included in that. So
Wow.
just everywhere. The goals are really of integrative medicine are to improve, again, quality of life, clinical outcomes. And I think the biggest and one reason it's gained such traction is it does empower patient participation. So
Mm,
when you're diagnosed and you're getting all of this information and you're having to basically do, I mean, you should do what your team tells you, you do feel out of control.
mhm.
You have this cancer, usually you don't expect it. And I feel like having the integrative medicine are things that patients can control themselves. So it
Mm,
hands back a little bit of a sense of that control to them.
yeah.
So really important. And it addresses the whole person. So I think, again, a lot of times with our standard drugs, we're addressing physical symptoms, but it can address emotional, social, spiritual health. All of these play a role. And I think more and more evidence is showing that all of the total package really plays a role in wellness and healing for a
And
patient.
outcomes. Yeah, absolutely. Yeah. I love the idea of, we always talk about, patients need to advocate for themselves. Patients need to be a part of the process. When we make decisions, it needs to be clinical decisions with the patient, informed, to help with that. And so I think it's really important that we call out that this therapy does empower the patient, and it does allow them to feel like they do have a say in some of the things, because I can only imagine, like you said, once you get the diagnosis and then all of these things, okay, you have to do this, you have to do that, and we're going to start doing this, we're going to do this, we're going to do that, and then all of a sudden you're just yes, okay, yes, 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 you're not even in control of anything anymore. So yeah, so I love the fact that it brings into that the patient and makes it more about them, which is
And
great.
can I also add one more thing? As
Yes,
pharmacists, like, I
please.
think it's really important for us to know what we're about to talk about, like things that do have guideline support. Because if you think about it, if 50% of people are at least are going to do it anyway, like, you want to make sure you're having that conversation and asking
Absolutely.
them, and that you can guide them towards things that are at least evidence based, and not going to, that will hopefully help and that will not cause harm. So
Mhm.
I really would also encourage people to have an open mind as we talk about these things, because if they're going to do it, at least as the pharmacist, you can guide them towards the things that do have better evidence and that may actually help with their outcomes.
Absolutely, yeah. As opposed to just they heard it on the TV talk show, whatever morning show, and they're like, I'm just going to do it. And if they ask us about it as a pharmacist, and we downplay it or we say that that's bad or whatever, it doesn't always mean that they're going to shy away from it. Like
Oh no.
yeah, it's probably actually going to push them, in the other direction, and then they're not ever going to ask you a question again because they don't want you to think that they're always doing stuff off book or whatever.
They're
So
not going to tell you too.
exactly, exactly. They're just not going to tell you, and then you're not going to have a whole picture of what's going on and what your patient is taking. So yeah, that's such a great point to you know even if you, I mean, using the things that are evidence based, even if you are, still not, I don't know what the word is, like sold on the idea. I don't want to say that in a bad way, but you still should be the one that's providing the information. We're the experts. We're the medication experts. That goes across, supplements and other things like that as well. So we should be the expert in that space. So yes, anytime they're asking about something, if you don't know, don't just say, I don't know, don't do that. That's not proven. Like, find out before you say that, because we want to be sure that we're keeping our patients close to us and that they're telling us things. So, all right. So, with that, let's jump into what are some of the opportunities and challenges that we see with integrative oncology. So, again, from the lens of a pharmacist, because that's obviously who our audience base is, and that's who we're speaking to today. So, let's talk about some of the things that they need to know in the space of integrative oncology, to be aware of. What are all the components of integrative oncology? So I'll let you start. You've got listed up here. The first one is mental health support. So let's talk about that.
Yes, yes. So I'm going to start the first three that we'll talk about. I do want to say come from the ASCO, which is the American Society for Clinical Oncology. I know Kelly just had the chance to attend that meeting, but
You
it's
did.
the
Huge.
largest oncology meeting worldwide. So
Yes.
it is huge. But so ASCO and then the Society for Integrative Oncology, which I mentioned earlier, have guidelines. They are published. Typically, anything that's an ASCO guideline, and CODA has an NCODA ASCO guideline on oral dispensing. But you can trust those. They're well researched. They're not going to publish anything that's not. So the first three areas we'll talk about come from the ASCO SIO guidelines. And like you said, mental health support. So not surprisingly, I think up to 21% of patients, which I think may even be kind of low,
I feel like that's very
have been
yeah.
shown to have depression during cancer treatment, with anxiety as high as, it says 17.9% is the most recent number I found. Again, I would think that that's
underreported.
100%, but even higher when first diagnosed, which makes sense, right?
Yep, sure.
So there are evidence-based methodologies for integrative medicine here. And the top ones recommended by the guidelines are mind-body interventions, yoga. There is some evidence for hypnosis. I will not claim to be an expert on hypnosis, so we probably won't talk about that much. Actually, acupuncture for anxiety, music therapy, and aromatherapy comes in here, which I love. So there is some evidence as well for lavender inhalation. So not ingesting. We never want to tell patients to ingest essential oils. But inhalation, and that could be through a diffuser, or they'll be like personal diffusers they can make that looks just like a little, you probably can't hear it if it's just audio, but it looks like a little pen or a little lipstick almost. And you take the cap off and you can just kind of like sniff it. Yeah. And that also is good for like if they were sitting in a treatment center and you can use your own personal inhaler instead of, diffusing it throughout the entire center.
Room.
Someone may be allergic or something.
Yeah, it almost kind of looks like a roll-on perfume or something, kind of. Yeah, and you just kind of take it off and I know what you're talking about. I love the the idea of music therapy. I mean, something as simple as like that is, and I think that we know that like what puts you in a happy place in general, and I feel like music is that for a lot of people. So yeah, these are great. So Ginger, when you mentioned MBIs, the mind-body interventions, like what's an example for the listeners on that? What do you mean by that?
So they're going to be things, as it sounds, that connect your mind and body, physical and mental, but things like guided meditation have been shown to do wonders in this space. And I know I'll say our team has even tried this on recent meetings, and it's been pretty amazing. But things like guided meditation.
Okay, great. All right, so next on the list is you kind of captured these first three, as you mentioned. So the next one in this kind of little group is pain management. So let's talk about that for a little bit.
Yes. So pain management, a lot of patients have pain, whether it is from their disease treatment or there are aromatase inhibitors used in breast cancer can also cause pain for patients. So acupuncture has actually been shown to help with AI or aromatase inhibitor pain and also just general musculoskeletal pain. And then also massage. And I do know of several even community oncology practices, in addition to, your bigger academic centers, that do have incorporated massage therapy for various patients.
Oh, wow.
That can be for chronic pain and also in like a hospice, if you're in palliative care, can help there as well.
Wow, that's great. And then another one in that space is cancer-related fatigue. So let's talk about that one for a little bit.
Yes. So cancer-related fatigue, I will say, is probably one of the most common side effects. Also can be very distressing during treatment. It's different. And I can speak to this. It's very different from your like, I'm
tired.
Super busy day. I'm exhausted. I just want to go to bed. It's persistent. It can be overwhelming for people, physical, mental, even emotional exhaustion. And it differs again from the fatigue that's just caused by your everyday exertion. You can't just rest it or sleep it away. Like it sticks around. And it has sometimes debilitating effects on your quality of life. If you can't do the things that you love or even that you need to do for your family.
Yeah.
And sometimes your occupation. So, you may not be able to get up and work, even though
Sure.
you really, A, may love to work, or B, may need to work to continue to have a source of income during your treatment.
Mm-hmm. Mm-hmm.
But it really, I think part of the problem is there's no one cause of it. It's multifaceted. So there's not an easy treatment solution.
Target. Mm-hmm. Yeah. Yeah.
And it could be multiple causes. So, it could be treatment and the disease itself from
Mm-hmm.
all different things. But here again, mind body interventions, which is like meditation and things. Exercise has been shown, which I I believe this fully, but has been shown to help with fatigue. So it
Okay.
may seem counterintuitive, and it's
Yeah.
not like go out and run a marathon, but like walking and light maybe weightlifting, but exercise can help with that.
Hmm.
Um, Tai Chi, and I can never say this right, so I'm gonna Qigong.
Well, I think you're
Right?
right. Yeah. I think that's it.
Um, like cognitive behavioral therapy. And then actually, here's where one of our natural products comes in. There is some evidence for American ginseng,
Okay.
and you could recommend. I would say, and we'll introduce the About Herbs app. Definitely, I'm not going to give a dose on here, but that would
Oh,
be
sure.
something you would need to evaluate the patient, the medications they're on, and
Absolutely.
it's not necessarily for long term, but in short term, can
Okay.
be a
Okay.
solution.
Yeah. Interesting. So that's a great segue because you kind of set it up as, one of the interventions of cancer-related fatigue is exercise. And so the next thing on our list is to talk about how exercise in and of itself can help with integrative. It can be a component of integrative oncology. Um, so what does that look like for if we're not using it in the fatigue-related component? Like what should exercise look like for a patient with cancer?
So I think that this is one of the most some studies that are coming out make this like very exciting times for exercise, because I think things that we know now are actually coming to fruition with the
Yeah.
evidence and studies and trials that have gone on. And I'll just give a personal aside here. I'll say during all of my treatment, I made sure I walked whenever possible. Like I had a
Hmm.
stem cell transplant. And my dad will tell you he was there at 6 a.m. like walking the halls with me when there was not a crowd around. And I believe like that got me out quickly. Like I do
Hmm.
believe that helped me keep up stamina and
Hmm.
really like respond to treatment and be able to complete treatment a lot more easily than if I hadn't
Sure.
done that.
Yeah.
But there is some evidence as well here. So there's evidence that structured programs post chemotherapy significantly reduce recurrence and mortality. And we just had a colon cancer study come out. It's kind of during ASCO times this year that resulted in a 37% reduction in risk of death. So I'm going
Wow.
to go through some of those numbers just to really show what an impact it can have.
Yeah.
But this 3-year structured exercise program, it's initiated soon after adjuvant chemotherapy, which adjuvant is after, for colon cancer, resulted in a significantly longer disease-free survival and findings consistent with longer overall survival. So in oncology too, our endpoint, like they were always looking for, is overall survival, and so
Hmm.
this actually showed some of that.
Wow.
But colon cancer again is the third leading cancer and the second cause of cancer-related death. It's despite the treatment, the recurrent disease develops in 20 to 40% of patients. And surgery and adjuvant chemo for colon cancer can cause side effects that undermine quality of life and reduce physical functioning. So the population is already at risk for decreased physical functioning. But this study showed that exercise significantly reduced the relative risk of disease recurrence, new primary cancer, or death by 28%. The
Wow.
disease-free survival curves began to separate at about a year and then continued to separate, which I found really interesting over the 10-year follow-up. Um, so, I mean, that's pretty amazing. Just
That's
showing
great.
you keep
Yeah.
something you can continue to do well into survivorship.
Hmm. Yeah.
And then
Absolutely.
exercise reduced the relative risk of death by 37%. the overall survival curves began to separate at about 4 years and continued to separate over the 10-year follow-up. So the magnitude of benefit from exercise delivered after surgery and adjuvant chemo was similar to that of many currently approved standard drug treatments, the study concluded,
Wow.
which, I mean, that's amazing.
Yeah.
So the increase is the equivalent of, because you'll ask, what does that mean? About 45 to 60 minutes of brisk walking 3 to 4 times per week, or 25 to 30 minutes of jogging 3 to 4 times a week. So, I mean, that's not, when you think about it, that's not huge to get
No,
that kind of a benefit.
to get that result. Yeah. That's
Um,
great.
So I know they also, one thing mentioned in the study that I also found interesting is the patients in the exercise group receive more social contacts with the physical activity consultants. So I think that was one of the things they couldn't completely rule out, that part of it even could have been related to that social interaction.
Wow.
And then they also concluded that you do need behavioral support programs to go along with it. So it's not just like telling patients to exercise, goodbye. It's really supporting them through that, having check-ins, giving them guided instruction, things that they can do, but really having like that actual program set up
Yeah.
for them.
And almost accountability and
Yes.
follow-up care. Yeah, exactly. Wow, that's such a great, impactful study. So yeah, thank you for sharing
It
that.
was huge. And
Um,
can I
ex-
mention one others with
yes, no, I
exercise?
mean, exercise. This is huge because I mean, this is a cornerstone in care for so many disease states. Exercise in general, for diabetes, for hypertension, for like so many of those. And so to hear it now being extrapolated and showing that it helps with cancer survivorship, like it's just important. Yeah. So please go ahead.
There's just no reason not to exercise,
Yeah,
right?
exactly.
As we're sitting in our desk chairs. But so there's also a study with the exercise showed that exercise enhanced immune infiltration during neoadjuvant, so kind of before surgery, chemotherapy. And prehabilitation exercise was associated with an altered, even tumor microenvironment and enhanced immune infiltration. So I just found that really interesting. Some of the preliminary studies that it was affecting immune systems.
Yeah, which if you think about it, it makes sense. Like you're revving up your system, you're keeping it active, and it's going to be stronger and better to fight off things. Like I especially thought about that when you were talking about it with your stem cell transplant. Like you think about what's involved with that. Like it's all about infection and white blood cell count and like all that kind of stuff. Like you think about like you were boosting your system, and I agree. I think that is what gave you a quicker turnaround than others, is because you were keeping your system active. So yeah.
Yes. And
Yeah.
I think we'll see with like immunotherapy and some of the like TIL, because the one thing that it did is raise the tumor infiltrating lymphocytes, which is another type of
hmm
immunotherapy
hmm
that's coming out. I think hopefully there will be some studies in the future that look at that and
Yeah.
that it's really helping those therapies
Yeah. That's great.
utilize your immune system.
Yeah, that's really good. All right, so let's move into some of the getting into more of the uh, I don't know, what would you say, actual things you take, I guess.
The
Yeah, so
actual drugs.
yeah, the actual medications or whatnot. So yeah, let's start with vitamin D is next on your list.
Yes. So there have been multiple studies that have shown support for survival across different types of cancer: breast, colon, lung, lymphoma. And there was one recent study, which is also exciting, I think, that women with breast cancer who were undergoing neoadjuvant chemotherapy and receiving vitamin D supplementation, so 2000 IU, had a higher pathological complete response rate than women in a placebo group.
Mm,
So some of the study will talk about their levels and different things, but if they had a value of greater than 20, we're more likely to achieve that complete response. So again, I think further studies are needed to validate, but really exciting. I mean, how hard is it to supplement vitamin D?
Yeah,
something
exactly.
really easy that a patient could do.
Absolutely. Absolutely. So keeping in that kind of supplement space and whatnot, let's get into some of the herbal and traditional medicines that have shown some evidence and talk about those.
So there are several. I'm not going to really get into like any specific ones
Sure.
right here, but I just want to point there is evidence from traditional Chinese medicine improving outcomes in advanced breast cancer, again, being used in addition to treatment, not by
Right.
itself.
Hmm.
And there are several reliable sources now, but probably the best that we use in practice, we used at the clinic. We've had one of the pharmacists who runs this website come and speak at one of our meetings within CODA, but it's Memorial Sloan Kettering. So they're a huge oncology center out of New York, but
Hmm.
they have an About Herbs app. And you can really find answers. They have everything is evidence based research there. So that's a great place to start if you sign up for their newsletter. I know they'll send you like a spotlight herb of the month or week. I'm not sure what it is, but something like that as well.
And to clarify on MSK's about herbs, Ginger, is it strictly? I know Sloan Kettering is big in the cancer space. Is it strictly about cancer care, or is it just in general about
So
herbal supplements
it's
and
in
things?
general, but it's really going to like focus on how things can be used in oncology.
Got it. Okay, so it has that spin, but also it's
Yeah.
going to
But I
tell
mean,
about
if
specific
it
things
will tell, it will give you a good amount of information on the herb that you could potentially extrapolate into some other
and to
case.
set into
Yeah.
use in some other space. Yeah.
But
Okay.
again, primarily it's oncology
Sure.
focused.
Sure.
Um,
Okay. And that's all the time we have for today's episode. But don't worry, we're just getting started. There's so much more to explore in the world of integrative oncology, and we'll pick up this conversation right where we left off in part 2. Be sure to join us for the next episode as we continue unpacking practical strategies and insights for pharmacists supporting patients through cancer care. Ginger and I look forward to seeing you back here again next week.